Hello, and welcome to the session Baby Just Arrived. Today we will talk about these subjects: newborn care, maternal care, hospital stay. The hospital stay usually lasts between 24 to 36 hours. During this period, nurses and physicians will provide care to your baby in order to ensure its well-being and prevent or detect health problems. Following birth, the baby is placed on the mother's belly and wrapped in warm towels. Secretions from the baby's mouth and nose are sucked out with a rubber suction bulb. The baby is wiped off of all liquids that have remained on its skin. The next 2 hours are a good time to practice skin-to-skin and to initiate breastfeeding. Then, the physician will perform a physical examination, and the nurse will measure the baby's weight, height, and head circumference. Vitamin K will be injected in the baby's thigh to prevent internal bleeding. Erythromycin ointment will be applied in its eyes to prevent infection through vaginal transmission. In the minutes following the baby's birth, the maternity staff will determine its APGAR score, which is the report of your baby's global health and determines if your baby needs special assistance or quick intervention. It is carried out at 1 minute of life and updated at 5 and 10 minutes. This score has no long-term value, but you can find it in your baby's vaccination record. You will receive several treatments in order to maintain good postpartum health and prevent unwanted complications. For example, you may need perineal repair or support for breastfeeding. Nurses will regularly measure your vital signs, monitor your bleedings, and massage your abdomen to stimulate the uterus. This maneuver is used to reduce the risks of hemorrhage. In average, the stay at the hospital after the delivery lasts between 24 and 36 hours, but it may vary depending on the mother and the baby's health. Cohabitation is encouraged, and you will have your baby with you 24 hours a day. When possible, you will have a private room. You and your baby will be seen by your respective physicians every day. A nurse will check your vital signs, your stitches, and your bleedings, and will massage your uterus during each shift. Your baby will be examined and weighed every day. A blood test will be performed at about 36 hours of life. Only a few drops of blood, taken from the heel, are necessary. The purpose of this blood test is to detect rare diseases that are often not apparent at birth, but that have serious consequences on a child's health. These screenings allows us to prevent or reduce serious permanent complications. Of course, all visitors must be healthy. If required, an intensive care nursery is available on the same floor. During your stay, you will have to complete documents related to the birth of your child. You should know that you can choose a maximum of 4 first names for your child. Pay attention to the spelling. You have 30 days to complete and send the documents to the Directeur de l'État Civil. You can complete them online or in paper. The Directeur de l'État Civil reserves the right to refuse the first name if it prejudices the child. Avoid puns or names such as Boom Boom, Poutine, Cosmo, Balthazar, Bozo, etc. The parents are not married to each other. Both of them must sign the declaration of birth so that the child affiliation can be established. Otherwise, the father's name will not appear on the birth certificate. The mention "father not listed" will appear on the birth certificate. It is important to discuss your contraceptive method with your physician before leaving the hospital. It is better to have it ready before having sex again. You have multiple choices, even if you breastfeed. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.